Welcome to the Massachusetts Region 4A Medical Reserve Corps. Thank you for your interest in the MRC. The MRC is defined as a national network of local groups of volunteers engaging in local communities to strengthen public health, reduce vulnerability, build resilience, and improve preparedness, response, and recovery capabilities. Civilian preparations for emergency response and preparedness are the cornerstone of the community capacity to respond to any emergency in a meaningful, careful, organized, and experienced manner. This is your first step in becoming an ambassador for the Medical Reserve Corps in your community. We will talk about many things in this presentation. We'll mention the important qualities of being a volunteer, what we do in the community and what we provide for the community, how we are helping District 4A, and how we can get more involved in projects. All volunteers must apply, be accepted, go through an intro course, and may go to many hours of training to prepare for clinics and emergencies. You have worked hard all your life to become where you are in your career. By volunteering, you will get the chance to experience new tasks that you might not necessarily face in your work area. Your skills will be put to good use and can help others learn from your skills, and you will also learn new abilities from other volunteers. You will also get to put your skills to work in the case of an emergency. You can expand your social networks by social interactions and meeting new people. You will have many opportunities to provide services to neighbors, friends, and family to keep the population safe. As mentioned before, you will learn firsthand and get to practice on dummies, people, lectures, etc. Your ideas bounce off each other on different tips or techniques of other volunteers. If you are willing to learn and work with others in your community and offer a helping hand to show off your expertise, then you are a perfect fit to be a volunteer. There are two types of volunteers, which we will talk about next, but for every one volunteer functioning in a medical role, there needs to be 5 to 7 volunteers functioning in a non-medical role. There are two different types of volunteers: healthcare professionals and non-healthcare professionals. No matter which you may lie under, you have certain rights that provide liability protection. If you are a healthcare professional volunteer, depending on your role and responsibility, you are protected by one or more of the following: Federal Volunteer Protection Act, doctors and nurses working in public health programs, protection for EMS personnel, protection for public employees under mutual aid agreements, and Good Samaritan laws. If you are a non-healthcare professional volunteer, depending on your role and responsibility, you are protected by one or more of the following: Federal Volunteer Protection Act, protection for public employees under mutual aid agreements, and protection for persons performing emergency services including CPR or defibrillation. In the link below, there is an attachment that goes into more detailed explanation for each protection rule. The MRC primarily focuses in these three key areas: public health emergencies, which are events that threaten the public health such as a disease outbreak or toxic chemical release; mass casualty incidents, which are disasters that cause injury or threats to large numbers of people. These can include a building collapse, fire, storm, flood, or other events that displaces groups of residents that must be moved to emergency shelters. And lastly, community service activities, which are opportunities to foster the well-being of local residents, such as health fairs, blood pressure clinics, or training programs. This picture is taken from the MRC Region 4A website. Region 4A is made up of 33 communities that form the General Coalition. These cities and towns include Littleton, Burlington, Lincoln, Weston, Ashland, Millis, Walpole, Boxborough, Woburn, Hudson, Waltham, Sherborne, Norfolk, Acton, Winchester, Sudbury, Framingham, Dover, Carlisle, Hopkinton, Sharon, Lexington, Marlborough, Southborough, Concord, Holliston, Wrentham, Stowe, Wayland, Bedford, Maynard, Natick, Medfield. There are many different events that a volunteer can participate in. Some of these events may include emergency preparedness and response trainings, emergency sheltering, responder rehab, disaster medical support, disaster risk reduction, medical facility surge capacity, first aid during large public gatherings, planning, logistical, and administrative support, veterinary support and pet preparedness, health screenings, obesity reduction, vaccination clinics, outreach to underserved community members, heart health, tobacco cessation, community event support, healthy living, health education and promotion, and engaging youth in public health activities. This slide shows some examples of recent events that have changed the way we view our neighbors, our country, and even our world when an emergency happens. In each of these cases, regular emergency responders were not enough. Before, during, and after these types of events, emergency responders are often overwhelmed and extra help to serve the population injured will be needed. The extra help can be volunteers who are organized, trained, and prepared to render help. Think back just a few years ago to the H1N1 pandemic. This new strand of flu was responsible for thousands of hospitalizations and death in 2010 and 2011. A short turnaround in vaccine manufacturing allowed for dispensing sites to vaccinate millions of people in the U.S. in a matter of a few months. Consider local disasters brought on by weather emergencies, such as flooding, ice storms, the snowy season of 2014. We've learned a great deal from these emergencies and how to best respond to them. New and emerging threats require ongoing training, and the MRC will provide that for you so that you are prepared. So what will the next crisis be? We don't have a crystal ball, but we can be certain of this. Unfortunately, bad things will continue to happen. Terrorists may be local or homegrown or foreign. Mother Nature will continue to surprise us with rain, hail, ice, snow, heat, and other weather-related events. And sometimes it's small like mosquitoes or ticks that can create a public health threat. Lastly, there are the smallest things on earth which have the capacity to cause the greatest peril for the public: a pandemic flu, a bioterrorism agent such as smallpox or anthrax, or a new or novel virus such as Ebola or Zika. Let's take a quick look back at the history of the MRC. On September 11, 2001, there were terrorist attacks in the United States. Hundreds and thousands of people wanted to do something, but there was no direction or oversight for this workforce. Large numbers of undirected people did not fill the needs associated with the crisis. Unregistered volunteers led to more chaos and subsequent frustration on everyone's part because of a lack of organizations. Hospitals were inundated with blood donors, and in reality, 45 days later, the majority of the blood was unused and discarded. So what we learned was that we are a nation full of generous people. People truly want to help in an emergency. Neighbors, near and far, were willing to drop anything to offer their help. Volunteers are absolutely needed to supplement the first and emergency responders. At the time, former President Bush utilized these findings and called for a volunteer corps of American citizens to help their fellow countrymen. This was the beginning of the USA Freedom Corps. This slide illustrates that at the national level, there is a National Citizen Corps Council. Under the Freedom Corps, there are 4 charter federal programs and national affiliates to expand the resources available to councils throughout the country. Citizen Corps also encompasses public education materials and public awareness campaigns. The delivery mechanism for all programs and activities is state and then tribal and local Citizen Corps councils, which are in the immediate interface with the American public. The basic or grassroots definition is simple. It is neighbor helping neighbor. It means you, as a resident of your town, helping to provide care and assistance to your neighbor or neighbors when you have been asked to do so. Major emergencies can overwhelm the capabilities of first responders, particularly during the first 12 to 72 hours. Medical and non-medical volunteers can provide an important surge capacity during this critical period. They can also support and augment medical staff shortages at local, medical, and emergency facilities. In short, communities often need trained individuals to fill in the gaps in their emergency response plans and to improve their response capabilities overall. MRC volunteers also strengthen the overall health of Americans by participating in general public health initiatives such as flu vaccination clinics, cancer screenings, healthy behavior support or disease detection programs like diabetes or hypertension, and others we have mentioned. Our surgeon, General Richard H. Carmona, has outlined his priorities for the health of individuals and the nation as a whole. The overarching goal, in addition to public health preparedness, is to improve health literacy, and in support of this, he encourages MRC volunteers to work toward increasing disease prevention and eliminating health disparities. The mission of the MRC is to establish teams of local volunteers in the medical and public health professions who can contribute their skills and expertise throughout the year and during times of community need. The basic concept of the MRC is that it is an organized and trained pool of volunteers and is made up of both medical and non-medical people. As mentioned, for every medical volunteer, 5 to 7 non-medical volunteers are needed. MRC volunteers are trained in all-hazard approach, also known as the CBERN, in responding to chemical, biological, explosive, radioactive, and nuclear emergencies. Volunteers can select which trainings they would like to participate in. The only training required by the MRC is this one, Intro to MRC, and Incident Command 101. These two basic trainings give all volunteers the concepts, scopes, and guidelines for deployments in an emergency or non-emergency health event. It is important to note that some training may be beneficial during MRC activities, such as basic first aid or CPR. The United States is divided into 10 MRC regions with 11 regional coordinators. The regional coordinators collaborate with medical and healthcare personnel as well as personnel at national, state, and local emergency preparedness agencies. There are 991 MRC units in 42 states, including the District of Columbia, U.S. and Virgin Islands, and Guam. Massachusetts has 47 MRC units. It's divided into subregions, and we are Region 4A, and Region 4A is composed of 33 towns and cities. There are over 206,000 national MRC volunteers and over 19,000 Massachusetts MRC volunteers. Some of the volunteers are physicians, physician assistants, nurse practitioners, registered nurses, dentists, veterinarians, pharmacists, mental health professionals, EMTs and paramedics, epidemiologists, health educators, and many non-medical areas. All are welcome to offer their help and contribute to their community. Now let's talk about settings where MRC volunteers are often deployed. Health clinics, whether in response to an outbreak of measles or in response to annual flu clinics for the community, health fairs, and other town functions. MRCs work with many partners all the time. Other volunteer organizations such as the American Red Cross, Elks, Rotary, faith-based organizations and churches, and also women's and men's clubs. If you are a member of a group, perhaps you would like to be an ambassador for the MRC. On those occasions, when you help your neighbor, being a volunteer makes us all more aware of helping each other. Some of the benefits to the community entail supplemental personnel to support existing public health and emergency response systems, mechanisms for information sharing and coordinating among the community partners. The MRC enhances community preparedness through citizen involvement, and also more autonomy in response to community emergencies with less reliance on state or national resources. Other benefits to the community include being able to provide specific health needs to the community, providing opportunities for private citizens to participate in developing strategies to make their communities healthier and safer, provide ongoing dialogue between emergency management and public health agencies, as well as providing national recognition of local public health and emergency response efforts. For example, if there is a local outbreak of measles, we form a volunteer steering committee to bring forth what is important to the town. We keep the public health at the table, and because we are Region 4A MRC and are already listed with the national headquarters, we want to bring the town on board and offer help in any way we possibly can. There are no hard and fast requirements. The only requirements is this intercourse, and all other trainings and drills that may be held or offered are not required. Any alerts for volunteers that may be sent to you, but keep in mind that volunteering for events is not required. Anytime you are contacted, you can always say no. You are not required to work outside of your town, although you may be asked to do so. But as mentioned, you can always decline. We would also like you to be familiar with some core competencies. They pertain to safety and communication. The 8 core competencies that we are going to focus on are personal protection protocols, personal and family protection plan, chain of command, the role of the MRC in emergencies, MRC communication protocols, mental and behavior health, volunteer activation and deactivation, personal limitation awareness. Core Competency 1, Personal Protection Protocols and Personal Protection Equipment. We need to practice healthy habits such as hand washing, knowing when to wear gloves or masks, proper disposal of waste such as needles, blood, broken glass, etc., and knowing when to take a step back when you are sick to not spread more bacteria. The personal protection equipment refers to protective clothing or equipment designed to protect the wearer's body from infection or injury. It can include anything from goggles, gloves, masks, aprons, shields, and guards. At any time, you can ask for appropriate personal protection protocols or personal protection equipment training. It's important to know the proper way to put on and take off masks, gloves, gowns, and goggles. Generally speaking, masks go on first and come off last. Let's talk about preparedness planning. First things first, you need to prepare yourself for the event of an emergency and have a plan. We know that in certain scenarios, things don't always go as planned. But if we create an idea of what to do and what steps to take, then it can be less scary and overwhelming. Let's have a family emergency plan. This includes memorizing numbers in case of an emergency, having steps of where to go and who to get in touch with. Make sure everyone knows how to text or call and know who the chosen emergency contact is and what their number is. It's important to include your children of these steps and plans so everyone is on the same page and there are no questions of what are we going to do. It's wise to find safe spots in your home and determine the best escape routes. It's important to practice these plans because if you are more familiar, you will be more comfortable and not stressed if the time ever comes that you have to apply these plans. Also, it's a good idea to have a plan for any pets you may have. Be a good neighbor and know when is the proper time to help, but always remember to protect yourself first. A Go Kit includes family health and financial information, an emergency radio, flashlight, snacks, space blankets, supplies, and funds to provide basic support for you and your family, including pets if you have any, for several days if you must leave home. It's also good to have emergency supplies that last 3 to 12 weeks. The weekly supplies can be canned or paper goods, and make sure to rotate them to the pantry to under the bed. Be sure to address specific family needs and pet needs and rotate your supplies as needed. The chain of command is as follows. First, the governor, then to the Massachusetts Emergency Management Agency, then to a city or town chief elected official, then again to a city or town emergency director, and finally to the incident commander or unified command. Here is a great representation of the incident command system. If you study this diagram, you can see that planning is a part of here. It's important to recognize that having a plan prevents chaos and ultimately helps everyone and everything run smoothly in case of an emergency. We will go over what each person is important for. Here is a list of some notable definitions of the staff. An incident commander is also known as a unified command. A public information officer provides communication and/or public information services. A safety officer is responsible for responder safety only. A liaison officer coordinates with other responder agencies. An intelligence officer is responsible for coordinating sensitive information. Some more definitions are a operations section chief, who is in charge of the actual response, a planning section chief, who is in charge of planning for the next operational periods, a logistics sections chief, who is in charge of obtaining needed men and supplies, and a finance or administrative section chief, who is in charge of expenses and keeping records. The line safety code is first responders must protect themselves and other responders, then protect the lives of victims, then control the incident, and finally protect property and the environment. The span of control is that each person is in charge of no more than 5 to 7 people and reports to only one person. It's important to be familiar with the use of common terminology for positions, procedures, and equipment so there is no confusion or uncertainty. In the management operation procedure, we must establish a command first and then ensure responder safety. Next, we must assess incident priorities and determine operational objectives. And lastly, we need to develop and implement an incident action plan. The role of the MRC in emergency is as follows. We provide support and assistance to incident commander. The volunteers will be assigned duties and tasks as the IC or section chiefs decide where you are needed. In the case of CBRNE emergencies, which again are chemical, biological, radiological, nuclear, explosive, or natural disasters, an all-hazard approach must be taken for possible evacuation and surge support. It's important to always be cautious for each situation or scenario because a careless mistake can be dangerous. The first step in emergency stage is planning and preparation. We need to update the strategic and operational plans and make sure they are updated weekly to see if any changes are made or need to be made. MRC units should be advocates and partners in the planning for all hazards. The second step is response. Emergency operations centers need to be proficient with each other in communicating to be sure everyone is on the same page. The MRC roles in controlling the incident is to provide a community reservoir for trained, credentialed volunteers, staff emergency dispensing sites, staff influenza specialty care units, support local board of health, and support local sheltering efforts. The third step is recovery. We have to bring things back to normal. The MRC may have a role in this phase due to volunteer efforts. The fourth stage is mitigation. We have to reduce the effects of an emergency by reducing the number of people and places that will be affected. For example, we can raise bridges so that they don't flood. The MRC units and members should be community advocates for mitigation work. Core Competency 5, MRC Communication Protocols. It's important to know that we must never talk to the media while deployed unless authorized by the incident commander. When authorized to speak to anyone, we must be correct, be first, and be credible. This is why it's a good idea to attend some training sessions offered so there is absolutely no misunderstandings or confusions whatsoever. If you are unsure, never say no comment, but say, how can I get back to you with that information? We should know the communication protocols at the scene and follow them exactly. We need to learn the radio and other communication protocols before using the communication equipment. We should take the time to communicate calmly, clearly, and completely with everyone, especially our team members. If you are ever uncertain, ask for clarification at any point. Everyone should be willing to help and offer knowledge and tips on any situation that may arise and how to handle it properly. MRC volunteers should be aware that accurate, timely, and complete communications are the most difficult part of an emergency response. But it is a lot easier when we work as a team and are constantly updating and communicating with each other. But always remember, no media. Core Competency 6, Mental and Behavior Health. Critical incident stress happens to responders as well as victims, which is short-term stress that focuses on an immediate or identifiable problem. Stress is normal. It's a normal reaction to an abnormal situation, so don't be flustered. Exercise is important to take care of yourself by taking a step back to breathe and also eating right to help keep you energized and aware. Stress can lead to substance abuse such as food, alcohol, drugs, cigarettes, etc. So stay away from anything that you think can take the edge off. If you feel you may be affected by stress, don't be afraid to take additional trainings on how to cope and work through it, or even take some time off. Always be calm, considerate, and compassionate to each person you are caring for. For example, after an emergency, give someone a glass of water. It may be just what he or she needs. Never tell a victim that you know exactly how they feel. Rather, acknowledge their problems when possible. Give them something constructive to do and always stay positive. Be aware that in a serious crisis, all affected people take in, process, and act on information differently. It's normal to see behavioral extremes and have difficulty communicating, so just be patient and let them know you're a safe zone to confide in. Core Competency 7, MRC Volunteer Activation and Deactivation Procedures. For activation procedures, a volunteer must be requested by State Board of Health Emergency Management Director or hospitals. They can be contacted by phone, email, or Health and Homeland Alert Network. So it's important to keep your contact information up to date and to check out the website frequently. Report when and where instructed and never self-deploy. Always ask about getting through security and parking. And always carry proper photo ID, including a current MRC badge if available. Bring along some basic supplies such as clothing, food, and water in case supplies are limited. Other things to keep in mind. Always sign in with the volunteer coordinator at the command post or staging area. It's important because it's to ensure safety, available resources, and for record keeping. Know who you report to and follow their instructions exactly. You could be assigned to any job, but no matter what it is, that job is important and that job needs you. Always sign out with the volunteer coordinator before you leave or go off duty. This is also to ensure safety for record keeping and resource management. Core Competency 8. Personal Limitation Awareness. Know your physical and emotional limits. Never become part of the problem. Always stay on top and stay ahead of things. Know your training limits. Stay within the scope of your training and skills. Just in-time training provided for critical tasks necessary to protect yourself and others. If you are ever unsure, always ask. We want to assure you that it is okay to have questions and you should never feel embarrassed to ask. We want to encourage our volunteers to always be engaging and always learning and constantly asking questions at all times. Lastly, always remember you are responsible for protecting yourself first and then others. The Federal Volunteer Protection Act is immunity from liability for negligence for people who volunteer for a government entity or a nonprofit organization. The Good Samaritan laws are state laws that protect healthcare workers from liability when they render emergency care or treatment. Coverage depends on there being an emergency. The Massachusetts Tort Claims Act is for public employees, and they are protected from liability for negligent acts or omissions if they acted within the scope of their employment. It is important to remember the state emergency declarations, which are during a large-scale emergency. There will most likely be special legislation or executive orders to help assure volunteers that they will have liability protection, but not likely workmen's compensation insurance. There is no workers' compensation protection in most situations for MRC volunteers. If you ever want to do additional research on your own or have any questions but don't want to ask right now, you can search on these websites for your answers. They are updated regularly and are very credible and accurate. We do have CORI and SORI checks. A CORI check is a criminal offender record information, which is a record of all criminal court appearances in Massachusetts for a particular individual. It includes any arrests, convictions, dismissals, and serious violations. A SORI check is a person's sex offender registry information. It's a record of convictions for specific sexual offenses committed as an adult or juvenile. It's important to have these and make sure that the volunteers offering help are credible and safe. The need for picture ID is becoming stricter. It's to ensure that you are who you say you are, and nobody is trying to impersonate anybody to cause any form of harm. Even though the MRCs are volunteers, we must apply before we are accepted. If we don't pass the CORI or SORI checks, and if we are not following the MRC guidelines, our volunteer memberships can be deactivated. The badging procedure is also going to be implemented. You must have your ID badge on you at all times so other volunteers and coordinators know who you are, where you will be, and what you will be doing at the site. Here are some discussion questions to see how well you are paying attention. Question 1. MRC volunteers must commit to a lifetime civilian duty. This is false. MRC volunteers may leave their community corps at any time. Question 2. MRC volunteers are only protected under Good Samaritan law. This is also false. MRC volunteers are protected under various laws such as Federal Volunteer Protection Act, Good Samaritan laws, and even Massachusetts Tort Claims Act. Question 3. There are many MRC opportunities for each volunteer. This is true. There are many different opportunities for MRC volunteers, and they have a wide range of opportunities. Question 4. An MRC volunteer must be a healthcare professional. This is false. An MRC volunteer can be a healthcare or non-healthcare professional. Question 5. The Peace Corps is under the National and Community Service Corps. This is false. The Peace Corps is under the USA Freedom Corps. And lastly, the MRC volunteers must be required to undergo various hours of training. This is false. MRC volunteers can attend training, but it is not required. This course is a requirement, and any other trainings are completely optional, and you can say no and not attend. Thank you for your time and interest in becoming a volunteer for the Medical Reserve Corps. We hope this intro course clarified any questions or concerns you may have had and are excited to have you as a member of Region 4A.